Take-Care offers federal employees and annuitants its high option, standard option, and HDHP options at very affordable rates. For example, the self-only biweekly share is $59.52 for the high option. For the standard option, the self-only biweekly share is $46.82. For the HDHP option, the self-only biweekly share is a budget-friendly $14.11.
In this section, we'll be going over the 2022 benefits for FEHB from Take-Care. And we're going to do a comparison between the high option, standard option, and HDHP options that are available to you on a side-by-side comparison basis. So when we look at the in-network benefits for the high option, you'll note that for this plan, most of the benefits are covered under a copay system. There is no deductible under the high option when you're using in-network providers. There's an out-of-pocket max limit, which is a financial safety net for you, which basically says that once you've reached $2,000 out of pocket for your medical expenses when you're using in-network providers, then the plan becomes 100% for the balance of the year. That's for each individual. If you're in a family, the most the family would have to pay in a year when using in-network providers is $6,000. There's a separate out-of-pocket max limit for prescription drugs. Again, it's $2,000 for an individual and $6,000 for a family. What's great about the high option plan, and for that matter, all of our plans, is that preventive care, all of your screenings, annual physical exams, and so forth, are all covered at 100% under this plan. For primary care, you have some choices here. You can pay a $5 copay for primary care at the FHP Health Center, or you can use any one of our preferred in-network providers and only pay a $10 copay for primary care at those facilities, or any of our other in-network providers, you would pay a $20 copay. Specialists are covered at 100% after a $40 copay after each visit, and laboratory services under Take-Care's plans are covered at 100%. When it comes to outpatient radiology, x-rays, you would pay a $5 copay at FHP and a $20 copay at any of our other in-network providers. What about emergency room? Well, this is the one benefit on this slide that has changed from last year. For 2022, if you have emergency room services, you'll pay a $75 copay for in-network or in-area providers that are in our network. And if you're out of the area, in other words, off island, outside of our service area, you would pay a $100 copay. When it comes to urgent care, there is a urgent care benefit at FHP, which is a $15 copay for each visit. And the urgent care center is open from 8 o'clock in the morning to 8 p.m. Mondays through Saturdays. As far as inpatient hospital, under the high option, you'll pay a $100 copay per day, up to $500 maximum per admission. In the case of services in the Philippines, those are all covered at 100% as long as they've been pre-authorized. When it comes to prescription benefits, you'll pay a $10 copay for generic medications, $25 for brand name, $70 for non-formulary, and anywhere from $100 to $200 for specialty medications. And you would get a 30-day supply, and that's for retail pharmacies through any of our pharmacy networks here on or off island. Now, you can save a lot of money by using our mail order program, which covers a 90-day supply at a $0 copay for generics, or $50 for name brand, or $100 for non-formulary. Specialty medications are not covered under mail order. If you're taking maintenance type medications on a regular basis, really seriously consider the mail order program, because you can save a substantial amount of money in the long run using that program. So here's our standard option as it compares to the high option. You'll see that it too is a copay type program. The major differences between the standard and the high are that the out-of-pocket max limit is a little bit higher on the standard option. It's a $3,000 per individual, or $6,000 for family, instead of the $2,000 and $6,000 for high option. Like I said before, preventive care is covered at 100%. Primary care is still $5 at FHP, but $15 at our preferred in-network providers. And it's $25 at all of our other in-network providers for primary care. Specialist care is $40. Laboratory services is $100, or 100% covered. Outpatient radiology is covered at a $5 copay at FHP, $25 at other providers in our network. And diagnostic testing is a $30 copay at FHP and $40 at other providers. Diagnostic testing covers things like MRIs and CT scans. For emergency rooms, your services are covered under a $100 copay in area and 20% coinsurance when you're out of the area. Again, this is an increase in your out-of-pocket expense compared to 2021. Urgent care is covered at $15 copay, again, at FHP, which is open from 8 o'clock in the morning to 8 p.m. Monday through Saturdays. Inpatient hospital is covered at $150 copay per day, up to $750 maximum per admission. And again, inpatient hospital services in the Philippines through our network there are covered at 100% as long as it's been pre-authorized. Prescription benefits are $15 copay for generic medications, $40 for name brand, $100 for non-formulary, and $100 or $250 for specialty medications. These are, again, retail pharmacies for a 30-day supply. And then you can save a substantial amount of money by going through the mail order program, even under the standard option, where you only have to pay a $0 copay for a 90-day supply for generic medications, 80 for name brand, and 160 for non-formulary. And then our third option is the HDHP option. This is a high deductible health plan program eligible for participation in a health savings account. I'll be going over that a little bit later in the presentation. For this plan option, you do have an out-of-pocket max limit of $3,000 as an individual or $6,000 as a family. That does not include the deductible. Again, there is a separate out-of-pocket max for prescriptions. Just like the other two plans, preventive care is all covered at 100%. You don't have to meet a deductible to have those benefits. And then for the balance of this program, most of the services are covered under a coinsurance basis, where you pay a percentage of the actual cost rather than a fixed copay. So in the case of primary care and specialist care, you're responsible for 20% of the cost. Lab services, once you've met your deductible, has covered at 100%. Outpatient radiology, diagnostic testing, those are all covered at 80%. You're responsible for 20%. And then for emergency room, again, that's going up a little bit from last year. It'll be a $100 copay per visit. Urgent care under the HDHP option is, once you've met your deductible, you pay a $75 copay for each visit at FHP, and that runs from 8 o'clock in the morning to 8 p.m. Mondays through Saturdays. Inpatient hospital is covered at 80%. Again, if you use our Philippine network on a pre-authorized basis, it's covered at 100% after you've met your deductible. And then as far as prescriptions are concerned, once you've met your deductible, then prescription coverage on a retail basis through your local pharmacies are covered under a copay. $10 for generics, $40 for brand name, $100 for formulary, and $100 to $250 for specialty medications. And then lastly, under the HDHP option, you do have the benefit of mail order prescriptions that once you've met your deductible, again, it's a $0 copay for a 90-day supply of generic medications, $80 for brand name, and $160 for non-formulary. All three options, high, standard, and HDHP option, do have out-of-network benefits. So if you are using a provider that's not in our network, it's not like there's no coverage. There is coverage as listed here. In the case of the high option and standard option, there's no deductible for out-of-network services, but the HDHP option offers you a deductible of $3,000 for an individual, $6,000 for family, and that's combined with the in-network deductible. So basically what that means is that whether you use in-network or out-of-network providers under the HDHP option, the deductible all accumulates together. So once you've met those dollar thresholds, then the plan begins kicking in its benefits. Same thing goes for the out-of-pocket max on all three options. The out-of-pocket max limit for the high, standard, and HDHP options for out-of-network benefits are combined with the in-network benefit. So there's a true advantage there. And because prescription drugs are not covered out of network under the high and standard option, there is no out-of-pocket max for RX under those two plans. And under the HDHP option, while we do cover prescriptions out of network, there is no maximum out-of-pocket. For the most part, under these plans, if you use an out-of-network provider, the plan is going to pay 70% of what we consider usual and customary, or what other folks call allowance, and you're responsible for 30% of that allowance. If that provider charges more than what we allow, or more than what we consider usual and customary, then you're going to be responsible for the difference between our allowance and billed charges. The only time that that does not occur is in the case of a surprise bill. And the No Surprises Act provides you some protection from unexpected out-of-network bills when you're using in-network providers. Another area where the No Surprises Act plays is for emergency rooms if you're using an out-of-network facility. In those cases, you're going to pay basically the same amount of money out of pocket that you would pay if you went to an in-network provider for emergency rooms. You're not going to be responsible for any charges in excess of what our allowance are. That's a big change over last year. And then as far as dental benefits are concerned, each of the medical plan options, the high option, standard option, and HDHP option, also offers you a limited benefit for dental services. Under the high option and HDHP option, those plans are fairly comprehensive, and they cover diagnostic and preventive services. It covers restorative fillings, simple extractions, prosthodontics. But under the standard option, only accidental injury, diagnostic services, and preventive are covered under the standard option dental benefit. And all three options cover up to $1,500 per year. So it's nice that these options do offer some dental benefit, but note that they are somewhat limited. And if you do happen to use an out-of-network dentist, there is some coverage available, and those are listed here.